6 months ago, I received a Hep C diagnosis. It came as a real surprise to me because I didn't think that I'd exposed myself. You know, in the last, I don't know, in the last 25 years, you know, I had like 2 brief periods of using street drugs, both of which followed periods of abstinence. So I did the detox, relapsed immediately after the detox. Might have used for like a couple of weeks or a month, and then went back into treatment. Now the last time I kind of, was tested was when I did an inpatient detox. Tested negative as an inpatient, used for a little bit on the street after I kind of relapsed. As soon as I came out, relapsed, used for a little bit. I must have gotten infected at that point, but because I'd just been tested, I just assumed, didn't think I'd put myself at risk. But I don't think we knew then what we know, as much as we know about the virus now, about how virulent it was, how infectious it was, how difficult it was to kind of avoid. So, you know, did he use other people's spoons? Did he use other people's water? Well, quite possibly, you know, and I couldn't swear that I didn't. I just changed doctors. You know, I haven't seen my GP for like since about 19. I haven't seen my original GP since about 1978 or 79. The last time I saw him, he was giving evidence in court against me, and so I hadn't been to the GP for like nearly 30 years. I got like a little growth on me, kind of like on my neck, and my wife was like, "You better go to the doctor and see about that growth." And so I thought, well, you know, what I'll do is I'll get a new GP, and then I won't feel, even though my old GP has died, you know, I won't feel quite so embarrassed about going back to the GP that I hadn't seen for 30 years. So I changed GPs, registered with a new GP surgery, and because I'm now a middle-aged man, who'd showed up on the radar, they wanted me to do all those middle-aged man tests. You know, Mr. McDermott, you're now in your late 50s, come in while we stick our finger up your bum, you know. So I was at my treatment provider talking to the doctor there, telling her that like how my GP kept on sending me all these. She was asking me, how's your health? And I'm saying, well, it's all right, but my GP wants to do all these tests. It's really annoying. I keep skipping them all. And she's like, oh, don't worry, I can do them for you. And I'm like, well, that'll save me a trip to the GP surgery. And she's like, oh, while I do them, shall I test for you like bloodborne viruses? And I said, yeah, sure, go ahead. Not thinking for a million years that I'd put myself at risk in any way, shape or form. It was between Christmas and New Year. And when your clinic doctor rings you at home on your mobile phone in that period between Christmas and New Year, you know something isn't right. And so I kind of knew from the moment that she kind of called me that like I had a positive diagnosis. And I think, you know, the dominant sort of like feeling was I felt like a prick. I felt like, you know, how could you have managed to become infected when you've known exactly what you needed to do not to put yourself at risk? You know, and so, you know, it was like shame, embarrassment. I think they were the kind of dominant sort of like, and then there's the kind of like anxiety and trepidation about like, what do I do now? Do I have the treatment? Do I not have the treatment? And then you've talked to people about who've had the treatment who like had a, you know, quite a difficult time of it. am I going to put myself up for that difficult time? You know, when I kind of talked to the doctor about it, when I talked to I said to her, what would you do? If you were in my shoes, what would you do? And she said, you know, because you know, the tests all look kind of good. You know, I had like good liver function, no sign of like cirrhosis, really low viral load, and I knew lots of people don't have the treatment. So I said to the doctor, I said, you know, what would you do in my shoes? And she said, I wouldn't think about it for a second. I'd go and have the treatment. And I think you can't why would you not take that advice, basically? So not having the treatment for me was never really a consideration, you know. As soon as I, like, somebody that I recognised was rational and understood the issues, tell me that it made more sense to have the treatment than not have the treatment, I was at least going to, like, have a stab at it, you know, on the basis that, you know, if it was ever really, really difficult, I could always stop it, you know. But to not start it made no sense to me at all. Once I made the decision to, like, do the treatments, I was a little bit anxious, and the first kind of like couple of weeks were I had some side effects, but I'm what, like 7 weeks in now. It'll be 8 weeks on 8 weeks on Thursday, and I think in terms of side effects, I think I've had as few side effects as you can possibly manage. You know, I've had no side effects from the interferon, really nothing from the ribavirin either. You know, I'm nauseous a couple of times a week. For the first month or so, I was really, really tired. Middle of the afternoon, I'd get like exhausted in the middle of the afternoon. But I'm kind of through that now, and I feel better. I feel better than I've felt for years. You know, I suspect that what was going on is I've had like low-level symptoms from the disease for like some time, and that the treatment's actually clearing those up. And so, rather than feeling worse as a consequence of starting the treatment, I actually feel much better as a consequence of starting the treatment. You know, so you know, I think I'm really glad I did it. I would encourage anybody who's got a diagnosis to at least explore it with an open mind and think about doing it. I think you'd be insane not to. You know, if it's difficult and you know it's too hard, then okay, back off and wait for the new ones to come in a couple of years' time, because there'll be new treatments down the road, new and better treatments down the road. But given how quickly the disease can kind of explode, why you wouldn't start the treatment as fast as possible makes no sense to me at all. You know.